most breeders have heard the term problem mare or have had a few of their own. But what exactly constitutes the so-called problem mare that we see in breeding? Most horse owners that have had problem mares know that it just takes a whole lot of extra money and extra cycles and still a lower chance of getting a pregnancy out of their mare. When we talk about problem mares, we mean mares that have been bred multiple times with decent semen, maybe over a couple of breeding seasons, and have not become pregnant. These mares might pool extra fluid in their uterus. Maybe they're the older maiden mare, or perhaps they have other conformational problems. Pretty much all mares, even the young healthy ones, will pool some fluid in their uterus after they've been bred because we've essentially put something foreign, being the semen, into their uterus, and this causes an inflammatory response. In the normal healthy mare, they're able to clear this fluid with little to no intervention and become pregnant after being bred. However, in the problem mares, they seem unable to actually turn off the inflammation, so even if you can clear the fluid out, they continue to produce more fluid and stay inflamed. This is part of the problem that constitutes a problem mare when we are breeding them. In order to more accurately determine what's causing the problem in your mare, there are a few different diagnostics we might recommend be performed, especially on a mare that's gone through several cycles or a couple of years without ever becoming in foal. These include steps such as uterine swabs to do culture and cytology to make sure there isn't an infection present, and also an endometrial biopsy. This helps us gives us a percentage of how likely the mare is to become pregnant and carried to term. We don't generally recommend these right away if a new mare doesn't catch on the first cycle, but it's more for mares that have become problems over the long term. Treatment-wise for these mares, there are several different things that we try to do to help alleviate the inflammation in their uterus. First off, if they have an infection, we'll try and treat that with antibiotics and get the uterus cleaned up before we even try and breed them. When we're breeding them, we often use something called a uterine lavage, or more commonly known as a uterine flush, in order to try and get rid of the inflammatory fluid that's within their uterus. During these, we can also actually infuse things into the uterus, such as antibiotics, and leave that sitting in there for a couple of days to help clear any residual inflammation. We'll then flush that out before we actually breed the mare, and then continue on with our lavages for a few days after we've even bred the mare in order to try and get her uterus as clean as possible to make a good environment for the embryo that's coming down. There are also a few systemic medications such as antibiotics and anti-inflammatories that we can give the mare to also help reduce the amount of infection and inflammation that might be present in the uterus. Once a mare is bred and confirmed pregnant, depending on her conformation, we might also perform a Caslix procedure. This is where we actually sew up a portion of the vulva to try and prevent it from being contaminated with feces or other foreign material in order to prevent that from getting into the cervix and causing further infection. With our problem mares for breeding, we also strongly recommend to owners that we use either cooled transported or fresh extended semen. Frozen semen tends to be highly inflammatory to a mare, as we've removed some of the anti-inflammatory properties of normal semen. Also, with live cover, we don't often get to follow the mare as well through a cycle, which causes problems when we're trying to treat them, and it also tends to be more inflammatory than using cooled semen. We also try and get them caught on their first cycle, because that's often the best cycle, and we see the inflammatory effects increase in subsequent cycles. So these are certain steps that you can take to try and increase your chances of getting a foal if you have a problem there.